Afternoon, good morning, everyone. Thank you so much for joining us this Thursday morning, just the day before the governor's stay-at-home order is expected. Okay, good.
Setting up, sorry.
It's showing, sorry, good practice. Okay, I think we're on.
You're on.
Sorry.
Oh yeah, we are on.
The governor's. You're on.
We apologize, everyone. Thank you so much for joining us this morning. We're joined now by the governor's press secretary, Krystal Paco-San Agustin, with an update with where we are in the governor's decision to extend that stay-at-home order or possibly lift any of the current restrictions in place. Good morning, Chris.
Good morning, Nick. Half a day.
So what can you tell us? We're almost 24 hours away from the governor announcing whether she'll extend that stay-at-home order again, or where is she at in making that decision?
Okay, so as you know, the existing executive order expires tomorrow, September 18 at 12 noon. So prior to that, Governor Leon Guerrero will be signing an executive order to extend that stay-at-home order one more week. Again, we've been taking this on a week-by-week basis, but I want to make sure the people of Guam note that there are modifications to this stay-at-home order, as we've recognized the people of Guam do need some additional things to make them feel more comfortable as they isolate at home. So let me break down those changes. Again, the stay-at-home order will remain in effect another week, but the changes I'm about to disclose, they won't take effect until tomorrow at noon when the existing executive order expires. So I hope that's not too confusing. I'll break down those parts that will change. So I like to call this PCOR 1.5. Right, so it's familiar. We've seen this before. This was probably a month ago when we first instituted the PCOR system, the PCOR 1 system. It's familiar to us, and the main difference is that non-essential curbside retail will be allowed to operate again. Non-essential can have the curbside retail. So this is some of your local businesses, they can operate. We're seeing a lot of people who need to buy underwear, to buy shoes, to buy some things that they can't exactly get at a grocery store or in the essential aisles at Kmart or Payless. And so also different. So one, the big difference is non-essential curbside retail will be allowed. And two, that restaurants and eating establishments may allow customers to enter the premises. So this is different from what we have right now. So they'll be allowed to have customers enter the premises for the limited purposes of takeout dining. So say you called in advance, now you can go into Papa John's if they wish to do so, to pick up your order physically rather than them coming out. So again, all of this, as always, is subject to public health guidance, which is forthcoming. Again, I cannot stress enough that these changes that I'm talking about, although the stay-at-home order remains in effect for another week, these changes that I'm disclosing right now do not take effect until tomorrow at noon, when the existing EO expires.
Right, and so this pretty much means that by September 25th, that's extended till noon, September 25th, the governor will be signing that executive order upon expiration tomorrow at noon. You're saying part of the restrictions to be lifted.
Signed sooner, it could be signed today or tomorrow. That just basically it'll be extending, yes. And so once I get that signed copy and it's transmitted, I will disseminate to you. You can have a harder look, but those are the most major changes. I know people want to plan for their weekend. They want to know how they're going to proceed in the next few days. I know that in times of uncertainty right now, we want to know even what tomorrow we can expect tomorrow. And so we recognize that the people of Guam want to know. So every Thursday, this has kind of been my thing to come out and say, this is what's going to happen, Guam. And so we thank the people of Guam for their patience, for staying home, please. Nick, you and I are of the age group that we think we're invincible. I really want to make this call out, especially to the 20 to 40-year-olds who think they're invincible, who actually are predominant positive cases. The newly confirmed cases are from this age group. You know, you are not invincible. You could be asymptomatic. You could be spreading it. Myself, I'm very safe. You know, I'm very safe about who is in my circle. I try not to affiliate with people who I don't live with in the same household. I think that's very important for people to know. Even sharing a meal could be your point of transmission. So if they don't live with you, maybe back off a little bit. Don't spend time, people, 20 to 40-year-olds, please don't go online hanging out to take the photos. We see you on IG. I see you at the beach. not wearing your mask, congregating, that's still not allowed. And so we urge the people of Guam, especially our young adults, please take responsibility. It's everyone's responsibility to keep us safe. The sooner we are able to, stabilize our numbers, not only our newly confirmed cases, but also our hospitalizations, then we can move towards the recovery that, we really enjoyed in PCOR 3 a few months ago.
Yeah, the hospitalization rates, Chris, as you've been reporting to us and bringing us those numbers, have been toeing around 50 on average each day. It's been a rough past couple of weeks with the number of fatalities growing just since the weekend.
August, we had several hundred new positive cases. August, we went months. I want to say 2 to 3 months without a single COVID-related fatality, and then suddenly it's become a daily occurrence. It's every day is another day to announce more sad news. At this time, I just want to update you. The COVID census at the Guam Memorial Hospital is 43, and actually, it looks like our ICU numbers almost doubled in the last day. There's 19 people in the ICU. 10 of those people are on ventilator support. And so if people of Guam, especially our young adults, our peers, Nick, if they're not able to recognize that these are some dire times and we really all need to do our part to stop the spread, then please, I urge you, if you haven't heard this message before, please stay home, stop the spread, save lives. But again, that stay-at-home order remains in effect. The changes that I discussed are mostly so that people of Guam can be more comfortable as we continue the stay-at-home order. We recognize that it can be stressful, it can be taxing. As the person that manages the governor's Facebook page and her social media, you see the messages. This woman wanted to buy an inflatable pool at Kmart. She wanted to buy an inflatable pool at Kmart because she wanted the rehab and to decompress from all the stress and fatigue she's feeling from COVID-19. She even asked if I go to my doctor and get a doctor's note, can I buy it at Kmart? And I still had to say no, unfortunately. And then you hear the stories of people who need to buy underwear for their kids. They're growing kids. Your kids are growing whether or not you have to stay at home or not. And so that's a big major change. I see a lot of men who work in construction who need to buy shoes. And they can't go to work or they can't do their work safely. And so those are some of the reasons why we've modified. Again, I like to call this PCOR 1.5. Since the PCOR system was initially 1, 2, 3, 4, modeled after our typhoon and tropical storm readiness preparedness model. But we've learned throughout the pandemic we've had to be flexible. So those are the major changes. Please continue to stay home. I can't stress that enough.
Yeah, and what's the talk among the administration there when it comes to the timeline to do the extension week by week and instead of doing it a couple weeks or even a month, since we're going into the 5th week now?
I'm sorry, repeat that question.
So why not extend it then more than a week if we're seeing this type of trend, when we're seeing the cases in the last month now over 2,000, the death rate more than going from 5 to 29 now?
To phase in our policies. We've always wanted to phase in our policies. Unfortunately, with COVID-19, it's not like the flu where you're exposed to somebody and you get it like the next day. It's COVID-19, we know, is the incubation period of 2 weeks. And so it may take as much as 2 to 3 weeks to see our policies, the effects of the policies we institute, but the governor's always wanted to phase in, push forward or pull back when we need to. And so that's the flexibility that this week to week guidance allows for.
I guess you could kind of get a sense too, you said you're reading the comments from people out there on social media, you get a sense of just how much this makes them a bit anxious, knowing that they're living on this week by week, though you say necessary.
Again, people of Guam, thank you for staying home, for doing your part. But yes, this week to week, I know people want to plan. They want to know what tomorrow brings. The businesses, they need to prepare. How are we going to handle what's next? Are we going to be able to open dine-in? At this time, we do know, what we know is that social gatherings, funerals, and bars and restaurants, or specifically congregate eating areas, are our top places for spread. So you probably won't be seeing any changes to those particular places, but we do need to make modifications to make the stay-at-home order more comfortable for our people. Like I told you, it's buying underwear for your kid. non-essential retail, going to Kmart and seeing it's barricaded off. I've heard stories of a woman who couldn't buy maternity clothes and baby clothes because it's blocked off at the stores. So that's what this allows for, this provides for, and it helps people to stay at home. It makes that living at home more comfortable.
Of course, no doubt. That's something that everyone does need, especially when they've been through this more than a month and it's our second time doing it. But what is the administration's position when people are saying out in the community that the stay-at-home order doesn't seem like it's working with the growing number of positive cases and the growing number of deaths we're seeing every day?
So for the people who are maybe questioning, the effectiveness of the stay-at-home order, my thoughts are that, we are seeing our numbers taper off. We're seeing them plateau. And I want to say that I would prefer a plateau or tapering off than a surge. In the month of August, I think it was 700 new cases. Like I told you earlier, we went several months without a single death. And now we're reporting 29 as of yesterday. And so we have to, if the policy isn't working, we'll pull back. If it is, we'll push forward. But at this time, we're seeing that taper off. That's progress. We're seeing, we need to get our hospital, most especially, down to an area where we're not as overwhelmed. And then we can proceed and start lifting restrictions again, revisiting restrictions and modifications. And it's every day is we have to evaluate the data, see what's happening, and then we institute our policies.
All right, Chris, well, thank you so much for your time. I know many people out there are looking forward to some of the restrictions being further lifted, but again, as Chris said, we have to stay at home. We have to still be safe when we're out there because we're still seeing those positive cases circulating, especially among those that are between the ages of 20 and 40 years old. So Chris, anything else that you wanted to add?
You know what works, right? So staying home, wear your mask, social distance, wash your hands. I think we're becoming a broken record, and my personal appeal to our peers, Nick, is that we do our part. We're not invincible. Don't do it for the grams. Stay home. If they're not in your household, stay away. Thank God we have technology. We have technology to keep us together during these really trying times. I also want to use this to segue and say, hey, don't download the app. We're all on our phones anyways. This is a little plug for the Guam COVID Alert app. Download it. It's a passive app, meaning you don't have to do any work. You just have to download it. It's free. Earlier this week, we reported over 10,000 downloads. The more people that download this, the safer we are, the more comfortable we'll feel about relaxing restrictions. I mean, very little work for you. All you have to do is download it, again, free. If you're positive, you input your status. And when you go out in the community, you can alert people because knowledge is power, right? And so as we start to lift restrictions, say you're in line at the very long post office and someone maybe in your area is positive, you get that alert without getting your invasion of privacy. And so it's safe, it's free, it helps us move forward in our road to recovery. Again, every different phases of this response will require different policies. And so that is why we're seeing such drastic changes. We're thankful to the people of Guam for being cooperative, for wanting to do their part to save lives.
Yeah, and as Chris was mentioning, that COVID Alert app, you can download it real easy right here on your phone. I've downloaded it, and she said we've reached 10,000. The goal is to get 60% at least of the island on this app so that it can be as effective as they are planning. But again, Krystal Paco-San Agustin, the governor's press secretary, just announcing this morning that the stay-at-home order will be extended another week to the 25th of September noon. Some of the restrictions that will be lifted is retail curbside will be allowed. People will now be allowed to do takeout, but go into the restaurants to pick up their foods. From there, we'll see how it goes as we monitor more of the cases. Chris, are we looking to hear from the governor? If not today, tomorrow?
Not tracking a press conference today, but I'm about to go into my 8:30 briefing, and so I'll let you know.
All right, stay safe, Chris. And
our 311 hotline, if
yes.
people have questions, we have a really good directory. Number one, if you call 311, you can talk to a nurse. If you have symptoms or maybe you're a little paranoid about possibly being exposed, what you can do, where you can get tested. Number two, if you're in need of public welfare, we recognize these are trying times. People need assistance. You can call number 2, that leads you to Public Health Welfare Division. Number 3 is our COVID Alert app support. So maybe you're a little hesitant to download the app. click number 3, speak to somebody who can give you that app support, maybe that reassurance of why you need to download the app or any of your questions, your burning questions about that app. 4 is to report a violation of the social isolation directive. I know you're seeing people out there on the beach, maybe congregating. This is the number you call. It leads you to the Guam Police Department RAC. That's a response activity coordinator. And basically we'll send out a team and we'll look into further that possible congregation. Number 5 is our crisis hotline. This has been a very valuable tool in our response as people really need help coping. We need someone to talk to. You're never alone during this pandemic. You can call our crisis hotline. They've been receiving an influx of calls. There's always someone ready to talk to you. Number 6 is our employment and unemployment guidance. If you want to talk to DOL, if you need help with their PUA payments, you can call them. 7 is for DOE parents. Parents, obviously, they might have a lot of questions about how to proceed. Distance learning is not easy. I think we're all learning. And then number 8 is general inquiries. If you don't know what your question falls under, call the Joint Information Center. We're number 8 on that directory. The menu options change a little bit after 5. And so just please listen for the directory. And again, there's resources there. We're always available to you.
All right, Chris, thanks for your time. And again, community testing ongoing with one of them happening Saturday at the UMATIC Mayor's Office. There was only 200. It's at a limit this time, but the Mayor's Council of Guam is working, of course, with public health to expand that into the other villages in the weeks and the months ahead.
Most definitely, I can tell you the governor's goal is to increase community testing like that to as much as 2 times a week. The 200 max is really so that you can be in line less. You can the wait time in line is shorter, so that you don't have to wait as long for results. We experienced that in mid-August, so you don't have to wait 10 days. It should be a 1 to 2 day turnover, because the same people who are swabbing you at these testing sites are the same ones that call you to give you your results. And so it's the best management of resources and human resources. And also we just want to make sure that we're able to give people their results in a timely fashion, less wait times on everyone's end. So again, thank you for the people of Guam who already registered for the UMATIC testing that is capped off. We will be announcing more testings as they become available. But if you need to get tested, if you're feeling sick, if you're really want to know more information about your health condition or your health status, please call 311 option 1, our nurse triage. You have Nurse Rose and her team. They are fantastic. They're a patient. They can walk you through the process. Again, kudos to all our frontliners. Thank you so much, Nick.
All right, Krystal, thank you so much as well. And again, quick highlight of this morning's interview: stay-at-home order will be extended another week into noon next Friday. Go to postguam.com for the very latest on all you need to know. Krystal, again, thank you so much and stay safe, everyone.